All right, back here in Los Angeles at the LD Microcap Show, and joining us right now is Greg Gorgas, the President and CEO of Artelo BioSciences. Greg, nice to meet you.
Thank you. Nice to be here.
Tell us a little bit about this company.
Well, we're a 18-month-old company, Artelo BioSciences, located in San Diego, California. And some investors came to me in early 2017 and said, we'd like to start a company in the cannabinoid space, sort of that cannabis pharma crossover space.
Right.
They think the area is hot. They've asked for someone like me to come along that has a sort of a tried and true blue ribbon background in drug development and commercialization, and start a company in this space.
So you have a few of those drugs in the pipeline. Why don't we start off with the cannabinoids, because that's obviously what people are talking about right now. So tell us what you have and what stages they're at.
So in the cannabinoid space specifically, there's three ways to modulate the endocannabinoid system that you have, that I have.
Right.
And that's with naturally occurring cannabinoids that can be extracted from the plant or made synthetically, from synthetic cannabinoids, or modulating what that endocannabinoid system is there for in the first place, and that's your own endocannabinoids. And Artelo is differentiated in that we have a program in all three areas. Specifically from the naturally occurring cannabinoids, we have a proprietary CBD, or cannabidiol. Steve, you've probably heard of CBD. You'd have to be half asleep to not have heard about CBD.
Yeah.
But the question of having it proprietary has eluded most companies. And in fact, that's really the special sauce for us. Because if something's in the public domain, it's hard to develop a drug company or a product around that.
Right.
And the FDA just recently approved a program or a product that has pure CBD, that is a pure CBD product, and that's Epidiolex from GW Pharmaceuticals.
Okay.
But they went down a route of orphan drug protection. That wasn't attractive to us. Other folks with CBD say it's kind of the space shuttle approach. I don't own what the cargo is, but I own this exquisite delivery system.
Right.
But then every chewing gum, ointment, cream, you name it, has been, and I think that's going to eventually be a commodity. Okay. So really what we did is we took advantage of, so to speak, an inherent flaw in CBD, in that it's polymorphic in nature.
Right.
And that polymorphism just means that something in nature can exist in multiple forms at the same time. Steve, you learned in grammar school that without even knowing what polymorphism was, because water, or H2O, can exist as a solid, a liquid, or a gas.
Right.
And while that's not a perfect analogy, you learn that something in nature can be the same substance and yet have different forms.
So where does this take us to as far as using this now for the consumer? What is it that you're developing?
Well, what we did is we created a co-crystal of CBD, and that's putting a straitjacket on CBD so that it stays in one crystalline form.
Okay.
When it's like a delivery system, and then when it goes into the body, this disassociates, and you're left with pure CBD. But outside the body, it's new and different. And this may, in fact, enhance its absorption characteristics. And so what we have in the bottle is unique, and we get a patent on that, 20-year patent protection. What we deliver in the body is the CBD that everybody is known to come and love. Okay. So our intention is to file an IND next year, and go into a phase 1, phase 2 study, drug development through the regulatory pathway.
Now we hear the term cancer and cancer being treated. Is that something that this is going to aid in as well?
Well, not specifically the cannabidiol. So that's a powerful anti-inflammatory. So we're looking at anti-inflammatory diseases. But we have two other assets that are destined in the cancer space. Okay. Should I tell you about them?
Yeah.
Well, the first one we got as a drug that had been developed to date at AstraZeneca, a large global pharmaceutical company. And that drug is exciting for us because it showed in its phase 1 studies profound impact on weight gain or appetite stimulation. In fact, every patient receiving the drug gained weight. Those that got placebo did not, with a high separation between the two. And so we believe that that's a tremendous opportunity. It's not hard for people to think that cannabis gives you the munchies.
Right.
But the profile of the drugs in the marketplace, or cannabis, is that it has some unwanted side effects. Ours stays out of the brain and works in the periphery. So it gives you the medicinal benefit below the neck and none of the psychoactivity above the neck.
Right, okay.
So we've slated that to go into a phase 2 study in anorexia associated with cancer. About 60% of people suffering from late-stage cancer treatment have anorexia that contributes to their demise. We believe it's important not necessarily, although we'd love to see it, restore people so that they can live longer, but certainly live a better quality of life for the time they have remaining.
So give us an idea about 2019. What's your sort of vision for this company and growing it in 2019?
Well, for 2019, we expect a lot of good things to happen for our compounds. First of all, that first program that I mentioned to you, the proprietary CBD program, we expect to file an IND and go into clinical development. We also expect to be issued our patent on 20 years protection. So that's some big milestones for 2019. For the anorexia drug, we expect to start the phase 2 study, and that's going to be very exciting for this company as well. Our third asset will be in IND-enabling studies, so we'll have to wait till the next year before that can go into the clinic. But our third program as a direct anti-cancer agent is also a very compelling program within our portfolio.
Very fascinating stuff. Well, great to meet you, and good luck in 2019. Sounds like
Thank you
some
very
really
much,
interesting
Steve.
things going on.
Pleasure to meet you.
Yeah, nice to meet you as well. Greg Gorgas, the President and CEO of Artelo BioSciences.